This is Dr. Jon Hinman, a Stanford-trained, board-certified MD who spent his entire career looking for the best possible solutions for his patients. And he tried injections, prescription medications, and even experimented with lasers, radio, and traditional shockwave therapies, but still, he could not find a consistent, repeatable solution for his toughest cases. And that is when he discovered something entirely different. Something that delivered results that he didn't even think were possible. And in this video, you're going to discover exactly how StemWave helped Dr. Hinman deliver life-changing results even for his toughest cases. Here's the story. See, most providers like Dr. Hinman didn't set out to become a pioneer in regenerative medicine. Simply, they wanted to give their patients the best possible care. And for years, Dr. Hinman followed the traditional path of conventional therapies. He built a successful practice treating pain the way that he was trained to: injections, medications, and protocols that focused on managing the symptom rather than fixing the problem. And while his patients were coping and maintaining, many of them weren't truly improving. They'd adjust their life around the pain rather than getting relief from it. And in his words, that wasn't good enough anymore. But here's the thing, Dr. Hinman's clinic isn't located in a major city where specialists or surgical options are abundant. He's in rural Alaska, where accessing healthcare means traveling hours or even boarding a plane just to reach the nearest specialist. So when chronic pain sets in or recovery stalls, patients aren't just looking for relief. They're looking for real solutions that work close to their home. And this is the reality that pushed Dr. Hinman to seek out a better way forward, a way that could finally deliver life-changing outcomes to the patients who needed it most. So Dr. Hinman asked himself a simple question: what else is out there? And he knew that there had to be a better way to help the body heal, not just to manage pain, but to actually repair tissue, reduce inflammation, and restore the quality of life from the inside out. And that's when his research led him towards a non-invasive regenerative technology. He explored countless different technologies looking for something that could deliver immediate, visible relief, even for the patients who had already tried everything else. And this is exactly what led him to find StemWave. Now, it wasn't an instant yes. Like many, Dr. Hinman had his doubts. And after all, he had seen plenty of devices that promised revolutionary outcomes only to end up gathering dust in the corner of an exam room. But after reviewing the clinical data, reading the white papers, and watching the videos of patient transformations from our providers, his skepticism started to fade. So despite some initial hesitation, Dr. Hinman decided to take the leap. And once StemWave arrived at his clinic, it didn't take long for the results to amaze him, his partner, and his entire community in Alaska. And for the first 6 months, Dr. Hinman personally delivered every single treatment. Not because he had to, he has a full office, but because he truly wanted to understand the nuance of what StemWave could actually do before committing to scaling it within his community. His first StemWave patient was someone who had already treated before, an older gentleman who still relied on a cane even after years of therapy. And after just one session, the cane stayed on the floor. From there, the story started piling up. A woman with 20 years of numbness in her feet feeling sensation again, regaining balance without any help. And even a military veteran with a frozen shoulder who had been unable to lift his arm for years, after just a few sessions with StemWave, had 70% mobility back. And a teenage athlete with post-glute surgery restored to a full range of motion in 3 sessions. Again and again and again, patients would come in for a treatment and leave in disbelief. For many of them, relief happened in just minutes, and it wasn't just relief, it finally gave them hope. Now, real quick, let's talk about Dr. Jon Hinman's marketing partner, Jon Stormark. As a former Division I tennis player, Jon had battled with chronic shoulder numbness for years, something he'd simply just accepted as a part of his life. But then Jon experienced StemWave firsthand, and in just one session, everything changed. That numbness, it never came back. That single moment shifted Jon from a skeptic to a believer, and completely changed how he marketed StemWave. Suddenly, it wasn't about promoting a new fancy device, it was about showcasing authentic transformations from people in the community using local radio ads, social media stories, and showing real patient outcomes. And yes, they discounted their introductory session to open up the doors, but it was genuine and jaw-dropping results that kept patients coming back in. And in tight-knit communities, word spreads fast. StemWave wasn't just improving lives, it was giving patients a story worth sharing. And for Dr. Hinman, StemWave was about more than just growing his practice. It was about building genuine trust within his community, real relief, real recovery, and real life-changing stories that turned patients into his biggest fans. So if you're a provider wondering if StemWave could work in your clinic, Dr. Hinman has one piece of advice. Talk to people who are using it. Learn how they integrated it, what they've seen, and what's possible in your practice. And now, at the end of the day, this isn't about adding another piece of equipment, it's about introducing a solution that brings lasting, meaningful relief to your patients. So if you're even a little bit curious to learn more, you can go ahead and click the link below to schedule a 15-minute call. We'll walk you through exactly how you can try StemWave in your office with your patients. And if the timing's not right and you're not ready to schedule a call, no worry. We've dropped tons of helpful resources in the description below, so you can check out those as well. Either way, I'd love to hear your thoughts and maybe someday even hear your story. Talk soon.